What the researchers found was that leaky gut increases the odds of developing autoimmunity by 30 times. And the good news is that you can test for it. And the crazy thing to me was they found that the higher the leaky gut antibodies, which is how you evaluate leaky gut, you do it by checking specific antibodies in the blood to part of your intestinal lining or intestinal barrier. The higher those antibodies were to the intestinal barrier, the higher the autoimmune antibodies were. So basically, in other words, the worse your leaky gut, the greater your risk for autoimmunity. So this is not just important for people who have an autoimmune condition. This is important for anyone who wants to prevent it and maintain good health. Welcome to the Hashimoto's Doctor Podcast. You're now part of a growing community of people determined to take their health back through education and self-empowerment. But because of the healthcare system today, we don't have access to the types of healthcare that we want. So we have to do things differently. We've got to do things smarter, and we do that by becoming our own advocates. This podcast will give you the perspective and thoughts of one of the world's leading Hashimoto's doctors. So let's get started. Hey everybody, welcome back to the Hashimoto's Doctor Podcast. I'm your host, Brad Shook, and today we're going to talk about something that is really a very important piece of research and clinical tool. Really, this results in updating and showing the importance of a very significant clinical tool that you need to be using, that if you have an autoimmune condition, you need to have this test done. If you're interested in preventing autoimmunity, you need to have this done. If you're interested in optimizing your health, in preventing the likelihood of chronic disease processes that are driven by inflammation, specifically from the gut, this, I believe, can also be really a valuable tool to help you with diagnosing and understanding a very important problem with human health, and that is increased intestinal permeability, or what is called, the lay term is leaky gut, but in the scientific literature, you'll find that it's called intestinal hyperpermeability, which is absolutely this significant pathological process where the gut lets things in, the intestinal lining lets things in from the digestive tract through the intestinal wall into the bloodstream, triggering a massive inflammatory response. And this inflammatory response can really flare up the immune system, set up the environment for, as you're going to find, the development and triggering of autoimmune conditions, and just of driving systemic inflammation. And just so you know, if you have leaky gut, you very likely have a leaky blood-brain barrier, which is also another physical barrier lining the vessels of the brain that has, as you're going to find out as we go through the podcast, I'm going to teach you about the components, some of the components of the gut lining. We won't get too technical, but technical enough that you understand this. The components that hold some of the cells of the intestinal lining together are the same components and proteins that hold the cells of the blood-brain barrier together. So when you have an immune response, which we're going to talk about, against intestinal proteins that hold the lining together, you're very likely to also have that problem occurring in the brain. So if you have a leaky gut or intestinal hyperpermeability, you are much more likely to have a blood-brain barrier hyperpermeability, or what we would call, the lay term for it is leaky brain. So if you're interested in learning about this, I'm going to talk about testing. I'm going to talk about, the impact of this, what is known to be or are known to be factors that drive this process. And we're going to talk about, how you can use this information to help yourself. Okay, so the first thing that I want to do is just make sure that we have a good foundation for this discussion. And I want to just briefly explain what is leaky gut, what are some of the drivers, what are the insights from this study, and then what are some of the autoimmune connections, so that we have a good foundation for the study. And then what we're going to talk about is how to test for it and then how you can use the testing information actually in a clinical or in a useful way. So before we get into that, though, I'd like to touch on the authors of this paper because they are very special researchers and people that have a tremendous amount of experience and a life of education and learning and research, and they are very special researchers. So there are three researchers on this paper, three authors: Datis Karazian, Martha Herbert, and Jama Lambert. And they have, I encourage you, and I will put in the show notes a link to more information about each of them, because they are very special people. They have, I just cannot tell you how, what a rock star group that this is, that is putting together this research and really helping humanity, helping us to be able to help ourselves, teaching us. So I'm very thankful for them and for this information and this paper that they put together, and then their life's work, which is tremendous. And so they've done so many other things. This is a small piece of their contribution, but I want to acknowledge them because they are such special people. I really advise you to look them up, and again, I will put links to more information about each of them in the show notes, so you can check that out. But I would definitely want to mention them because of the importance. So the first thing that I want to get into is talking about this study a little bit and making sure that you have background information on leaky gut, just a little bit of information here, so that we have a good working foundation from which to build upon. So the leaky gut is a condition where the intestinal lining becomes overly permeable or leaky. So your intestinal lining is selectively permeable. It's literally an immune barrier system. Your intestinal lining, a lot of people don't think of it that way. And you know what? I never did either until I learned that it is. It is an immune system barrier. And whenever that immune system barrier has dysfunction, it typically is because it's broken down and it is letting things pass through into the bloodstream from inside the intestines. The things are the digesting food, the bacteria, the things that are in the gut, whether it's chemicals from the environment or anything that your liver is dumped into your bile and your bile mixes with your food. Anything in there that your body's trying to clear as well. That's all in the intestinal tract, and you have this this microbiome, all these different types of bacteria. And the things that those bacteria produce as a byproduct of their metabolism, that's in there too. There's all these different things that are in the gut, and some of those things we don't want to pass through the intestinal lining into the bloodstream. We want those to pass out with our stool. And when that intestinal lining breaks down, it lets those things pass through. A lot of those things pass through into the bloodstream, and many of those things can drive a very strong, significant immune response. And this immune response has been shown time and time again to lead to a number of health problems. And we're seeing in this paper that it's a 30-fold increase in the odds of developing autoimmunity. And this is something I can tell you I've known clinically, not this specific number, but I've seen this clinically. If someone has an autoimmune problem and they haven't been treated for their gut and their condition hasn't been supported with the appropriate dietary and lifestyle temporary supplementation interventions, then they're very likely to continue to have intestinal permeability or leaky gut. And those people, whenever I find leaky gut in someone, they almost always have autoimmune markers. So these things, I could always see that these things went together. So it's a significant problem. And so these pathogens and things that these toxins, these microorganisms that can escape into the bloodstream, they trigger this strong systemic inflammation, and they promote this autoimmune process. And the thing that you need to know about the gut lining is that the intestinal walls, they consist of a special type of cell. They're called epithelial cells. And these cells absorb nutrients from the food while they prevent a lot of these things, these compounds, these bacterial fragments or pathogens, these partially digested foods, these chemicals and whatnot from passing into the bloodstream. So again, they're selectively permeable, right? They let things through that should be there, and they keep other things out. And these cells, if you imagine, the intestinal lining only has one layer of cells. So if you just imagine like bricks lined up touching side by side, that's it. It's not like multiple bricks stacked on top of one another. That would be representative of multiple cells. In this analogy, each brick would be a cell. Okay, one cell. So they're just like your intestinal lining is one cell wall thick. So these cells are bumped side to side, and then they line the intestinal tube. And then on top of that, you have you have mucus, and you have enzymes, and you have other things there that compose the layers of that intestinal lining. But the lining itself is only one cell wall thick. So that's important to understand. Now these cells where they touch together, the side to side. So imagine where the bricks are butting together, just side to side. There are proteins that hold them together, and this is really important to understand, because where these cells touch together, the sides, there are these proteins. One of the protein, the primary protein there is called occludin, like to occlude or close, and this molecule, it prevents pathogens and these things from passing into the bloodstream. Now, this protein that holds the cells together, it's regulated by a protein called zonulin, okay? And this protein, zonulin, it tells occludin, which is a protein between the cells, when to open and close these junctions, right? The junction where the cells touch side to side. So when the gut damage, when it occurs, this occludin and zonulin, they get caught in the inflammatory response, and the immune system starts to make antibodies, which is basically like a tag against something that is foreign. It starts to make antibodies against these proteins to help remove those and then the dead and damaged cells. So your body will make antibodies against your own tissues as part of a cleanup process. So there's like a low antibody number is expected, because it's part of like a cleanup crew, if you could say. But the higher that it gets, then there's the more and more either severe the damage to the gut lining, or the more inflammation that's occurring there, the greater the immune response. So this is how the intestinal permeability was measured in this test. They looked at antibodies against the occludin and the zonulin. And so what they did was they checked to see if these markers related to the markers of autoimmune reactions, which are also antibodies, but they're just antibodies, different antibodies that they check in the blood against your own tissues or self tissues. And this was pretty shocking. I didn't realize, and I wouldn't have guessed this, but what they found was that people that had a leaky gut had up to a 30-time or 30-fold increase in the odds of developing autoimmunity compared to those without it. And they showed that an elevation in these antibodies were, the higher the antibodies were against the occludin and zonulin, the higher the autoimmune antibodies were. So in other words, the worse your leaky gut, the greater your risk for autoimmunity. Before we move on to talk about like the progression and how you can actually use this data, I wanted to make a point that there was also a correlation observed between zonulin and occludin. Remember, these are the proteins that are involved in those junctions. These antibodies against them in neurological autoimmunity. So autoimmunity against neurological tissues. And this is important to understand because the brain, as I mentioned earlier, the brain has a barrier, and it's similar to the gut barrier, and it allows specific compounds and things through that should help with brain function and normal brain physiology and chemistry, while keeping pathogens and antibodies and things out of the brain that should not be there. And the blood-brain barrier is also comprised of zonulin and occludin. So it's very similar to the gut lining. And so the research that's been done suggests that a breakdown of the blood-brain barrier plays a role in neuroinflammatory disorders. And this is like, we're talking about like Alzheimer's, any type of neuroinflammatory brain degeneration, brain autoimmunity is what we're talking about here. And the past studies that have been done show a correlation between intestinal permeability and multiple sclerosis. So this is really important information to understand. I mean, when you're working with autoimmunity, this is I feel like this is essential to know because it allows you to establish a baseline, and we know that this is such an important gateway and mechanism that if you can identify that there's leaky gut or intestinal permeability and you can do something to actually heal it and improve it, it is going to be a significant improvement for the immune system. It's going to help to diminish the inflammatory response and this bombardment of triggers, from the intestinal tract into the blood. So this is critical. Now, another thing that's really important to understand is that leaky gut has also been shown to promote autoimmunity against bone and joint tissue. So remember, the researchers looked at 24, I don't know if I mentioned this, but they looked at 24 different human tissues, and they found that there was 17 of the 24 were, they found a correlation that were positive or reactive in people that had leaky gut. So the importance here of, or the connection here between the bone and joint autoimmunity is that the intestinal permeability or that leakiness can lead to bacteria moving from in the digestive tract into circulation, and that promotes inflammation in the bone and the joints. So this is huge. I mean, if you know someone that's dealing with, for example, rheumatoid arthritis, this could be a potential mechanism, a contributing factor. They also found that there were, other tissues that were reactive. Again, I said 17 of 24, but in particular, things like thyroid autoimmunity, liver autoimmunity, pancreas, and then I believe GI autoimmunity was another one as well, like ulcerative colitis, Crohn's. So this is a major mechanism that needs to be identified. So we know that leaky gut leads to an increased risk of developing autoimmune diseases. Now, so you need to understand that there are stages of autoimmunity too. So if there are three different stages that most people agree to when we're talking about autoimmunity. So stage 1 of autoimmunity is where you have antibodies in the blood against a particular tissue. So let's just say it's your thyroid. You check your blood, you have a blood test done that's looking for thyroid antibodies. So that those are antibodies that are produced by the immune system. You can think of them as like tags that tag something that's foreign. And so you're going to have a normal, low amount of antibodies. They should be below, the lab range, or they should be within normal, which is considered, normal for cleanup, for tissue cleanup, for repairing damaged tissues or for cleaning up damaged and dead cells. But they shouldn't be elevated. If they're elevated, then that is an indication that there is an abnormal immune response. In most cases, it's abnormal. But stage 1 would be antibodies, but no symptoms or disease. Okay, so you just do a blood test, you feel fine, you don't know of any autoimmune process, but the antibodies come back elevated. So that would be stage 1 autoimmunity. Stage 2 autoimmunity is where you have elevated antibodies and you have some symptoms, but the condition hasn't progressed to a point that there's a disease state that requires medical attention or intervention. So, for example, you have symptoms like, let's say it's thyroid autoimmunity. You have antibodies and you don't feel well, but when the doctor checks your blood work, you don't have a low thyroid. So they're like, oh, there's nothing to do. You don't need any kind of thyroid hormone replacement. So, it's not, they'll say things like it's not your thyroid, or most of the time they don't say it's not bad enough yet, but I have heard that before. But, so they're just like, well, there's nothing wrong here. And the fact is that thyroid antibodies do cause problems. There's more and more literature that shows that they contribute to a number of problems. So if they're elevated, they can definitely be problematic for you and cause suffering and symptoms. So stage 3 autoimmunity is where you have antibodies, you have damage to the tissue, the target tissue. So in this case, we're talking about the thyroid. That's extensive enough here. This is the thing to diagnose a disease and require medical treatment. So this is a situation where, their antibodies are present. Let's say the thyroid is swollen. Let's say they do an ultrasound. They can tell changes to the thyroid that indicate an immune response and scarring against it or swelling. And then the third thing would be that there is, let's say, a high TSH level, which would be an indication of low thyroid hormone. And so it requires medical intervention at that point. So that is where autoimmunity gets diagnosed, or, hypothyroidism in that situation would be diagnosed. But typically, antibodies aren't enough in and of themselves to diagnose an autoimmune condition, because an autoimmune condition is a clinical diagnosis with antibodies plus symptoms. And then, it's made in a clinical setting based on, the severity of the condition. It's not just antibodies. Most doctors will not diagnose you based on antibodies alone, and because technically that's not how it's done. So hopefully that makes sense. But there are these three different stages. So keep this in mind, because if you are like in stage 1 or stage 2, and you learn about like leaky gut, that you have this intestinal permeability, and you start working on improving it, removing the triggers, trying to support and heal the gut lining, then you may actually prevent the progression by repairing the gut. And you also have to, or need to, identify your autoimmune triggers, which typically fall under three different umbrellas: pathogens, food proteins, and chemicals. Also stress, and there's some other things in there that kind of fall in a fourth category. But you've got to identify your triggers, and then you have to maintain a dietary strategy and a lifestyle that helps to dampen the inflammation. But if you're in stage 3, then you can, if you're implementing the same kind of strategies, but you're in a more progressed state, so you already have, you have the stage 3, so you have the antibodies, you have the damage to the tissue, and you require medical treatment. It's not like all is lost in that situation. You can absolutely implement strategies that help to dampen the autoimmune process, and really the goal would be there to improve symptoms and then work to prevent the disease from worsening. That would be, the goal in that situation. But that's really the importance of understanding the stages, because you can identify some of these things. If you can identify them early enough, then you can implement strategies. You can establish a baseline, implement strategies, and then you can retest to see if you've made progress. And then obviously, hopefully, you're feeling better. Okay, so now that you're familiar with leaky gut, you better understand the connection to autoimmunity, and you're familiar with the stages of autoimmunity, the three different stages. Let's talk about some of the drivers of autoimmunity, and then talk about testing and how you can consider using it. So a lot of people, they hear this term like leaky gut, and they think, well, hey, I don't have any type of GI tract problems. My gut's fine. I don't have any issues, so I don't have leaky gut. The thing is, this is not something that is necessarily, you don't necessarily have symptoms. This is something that a lot of people, if you ask them if they have intestinal permeability or leaky gut, they would say, no, I don't think so, because I don't have any GI tract problems. I will tell you, I worked with a gentleman who had severe rheumatoid arthritis, and he came to me, he had been to his primary care physician, and, they did, blood work and, the normal workup that the rheumatologist would do, looking at antibodies, and they identified that, he had rheumatoid arthritis, and he had high inflammatory levels in the blood, which is really common with rheumatoid arthritis because of all the tissue destruction and inflammation. And then they recommended steroids and anti-inflammatories, and then ultimately they were recommending biological medications or biologics to help suppress the immune system, to preserve his joint tissue, which, guess what? In some cases, absolutely. I totally agree. Listen, there's always a place and a time and place for these types of more aggressive interventions. But please consider working with someone that can help you to look at the driving mechanisms behind this autoimmune processes, because there's typically a lot that you can do to help dampen this autoimmune process. And it doesn't mean that you'll avoid going on a biological or a biologic medication. However, it may be the difference in if you can identify some of the triggers, you can identify leaky gut, you can work to dampen the autoimmune process, you may preserve more of your tissue, have a better quality of life, have lower inflammation, and overall have better outcomes even while you're taking the biologic. So here's the thing. He presented to my office. We did a number of different tests on him. He came back with a true bacterial infection in his gut, and he had no symptoms. He said, you know what, I don't have any problems with my bowels. There's no issue. But he absolutely, he was tested. We had him tested. He had lab high levels of considered pathogenic levels of a particular bacteria. And he went through a protocol. I encouraged him to talk to his primary care doctor, which his primary care doctor recommended a specific antibiotic that the bacteria was sensitive to, because that particular test that we did with him, they did a culture. The laboratory did a culture of his stool, and then they did sensitivity testing to that bacteria that was overgrown. And so we knew the herbals that it was sensitive to, and the antibiotic. So he talked to his primary care, got an antibiotic. I put him on a series of herbals to support getting rid of it. And within a month or two, he had significant improvements in his rheumatoid. And this was an absolute game changer for this guy. He was like, this is the end of the road for me. He said, if you can't help me, then I'm just kind of stuck with what I'm at, where I'm at here. And he was able to go up and down stairs better. His quality of life was definitely improved. So it doesn't mean you don't necessarily have symptoms of when you have intestinal permeability. So it doesn't just come out of nowhere, though. There are definitely drivers and causes. So let's go through some of the drivers and causes. So GI tract autoimmunity. If you have celiac disease, Crohn's disease, or ulcerative colitis, those are the most severe forms of leaky gut. Those are absolutely the worst forms. And the reality is that the immune system is attacking the barrier, and you can still make progress and most of the time and dampen that autoimmune process to at least to some degree. But those are the some of the most severe cases and most challenging, because the immune system's not attacking a different tissue in the body. It's actually attacking the barrier itself, which makes it even more challenging. So gut autoimmunity, GI tract bacterial imbalance, what we call dysbiosis. I've seen that many times to be a contributing factor to increased intestinal permeability. And I think that's due to our diets. A lot of people eat processed foods. Those processed foods have flow agents and different things that disrupt our gut lining, the mucus layers. They have food colorings that bind to our tissues, the epithelial cells. They have sugar that feed the wrong bacteria and feed a candida overgrowth. Then the next thing I think that would is right up there are food sensitivities. So you can check not just food allergies. There are different ways your immune system can react to foods, and there's not just allergies. So you can do blood testing, you can do skin scratch testing. Those are all valid tests too that look at food allergies. But food sensitivities are a different way the immune system can react, and you can check antibodies. You can also check the innate immune system for reactivity. There's testing out there that does that. But anyway, reactivity to foods. So if the food drives an inflammatory process, that's also something. Gluten sensitivity is also a big factor that I see. A lot of people do not do well with gluten. And, there's probably a lot of reasons for that. I mean, listen, gluten is delicious. Gluten and wheat products are absolutely delicious. However, they are causing a lot of problems for many, many people. And I see it because I do testing, and I can see that the primary foods that people react to are going to be wheat and proteins found in wheat, eggs, dairy, yeast, soy. Those are probably the top ones right there that almost everyone that I work with that's autoimmune, most people have reactivity to those foods. And there are various reasons why that's occurring. I mean, it might be because they're so prevalent in our diet. It could be because gluten is, not only is it prevalent in our diet, but it's also highly refined. So you get this ultra processed gluten that is in a much higher concentration than we would get it if we were hand milling it and breaking it down. Plus it's been over, the past 60, 70 years, it's been hybridized. So it's been crossbred to have more favorable types of wheat. So that so you can get better harvest, which makes sense, right? But it does change the protein structure of the gluten. And then if you get if it is sprayed with an herbicide to accelerate the time of the speed of drying the wheat at harvest, so that it can be harvested faster and the field can be turned over more quickly. That is also a residue that's there. If it's genetically modified, what impact does that play? So the wheat is different. The wheat is definitely different than it's been. It's processed. It has, it may have residues on it. And so it's different. It's not like it's rapidly changed, and our bodies haven't adapted to that. And so there's a bunch of problems with wheat and with gluten, and that's one of the things that I see that drives that. Other things, chronic stress drives cortisol that can interfere with the epithelial layer turnover and regeneration. Chronic sleep deprivation is a huge one too. Similar situation, the body cannot repair. It drives inflammatory pathways. If you're on like steroids, if you're taking antibiotics, that changes the gut bacteria. That can really do a lot of damage there. Non-steroidal anti-inflammatory drugs, those medications are known. It says on the bottle, and a lot of people know that if you take those medications for a prolonged period of time, those NSAIDs, that they can cause ulcers because they do damage to the epithelial lining. Alcohol consumption can definitely do damage. Vitamin D deficiency, because for so many different reasons, how it affects the immune system and immune regulatory function. Let's see, what else? Brain injuries. People don't know this, but when you have a brain injury, it definitely induces intestinal permeability. 100%. There's a study that was done, and I believe it was in a mouse model, but they showed that within minutes of a TBI, a traumatic brain injury, that intestinal permeability developed. And this is an incredible connection, but there are a lot of issues. There are more reasons than that, but these are just the things that I can think of off the top of my head as like some of the most common reasons that you might develop intestinal permeability or leaky gut. So many of us are predisposed to factors that would drive leaky gut and intestinal permeability. So with that said, what can we do? Like, what kind of strategies can we implement to try to help ourselves? So if you're autoimmune, or if you're trying to prevent autoimmunity, or if you want to just try to keep your gut in optimal health and prevent chronic inflammation, then what I would recommend that you do is you get testing done to help you evaluate whether or not you have leaky gut. So the test that I use is Cyrex Laboratories, and Cyrex Laboratories has a number of different panels that check for antibodies against occludin and zonulin. They also have a panel that looks at antibodies against lipopolysaccharides, which is a component of bacterial cell wall, in gram-negative bacteria. And these are the bacteria that are, in general, more pathogenic to humans, the gram-negative. And so when these bacteria break down and fragment, they can pass through into the bloodstream, and that cell wall that has the lipopolysaccharide in it, it drives massive inflammation. I mean, this is a really strong inflammatory response. So the testing, one of the tests that I use, I can't remember which one it is, but there's a blood test. There's also a blood test that I'll use for the blood-brain barrier to assess it. And then there is another test. They've come out with a test recently that is a salivary test. And it's a great test because, you don't have to go get a blood draw, but it's a salivary test that also looks at the intestinal occludin and zonulin antibodies. It looks at blood-brain barrier antibodies. I don't know if it looks at the lipopolysaccharides. But anyway, you use one of those tests. You get one of those tests done to assess whether or not you have leaky gut. And if you have intestinal permeability or leaky gut, then what you do then is you need to put together or work with someone to put together a strategy for you, a dietary, lifestyle, and temporary supplementation strategy. Typically, you go 4 months. That's how long I recommend, and then you retest. And sometimes you need to get additional testing. If you're autoimmune and if you have it in your budget, 100%, if you can do additional testing to quantitatively assess antibodies in the blood against specific food proteins, specific pathogens, specific chemicals. If you can look at vitamin and mineral status, if you can, you do your basic labs as well, for sure. I mean, those are absolutely, foundational. Then you can put together a more unique strategy, and you can utilize that to support your unique immune drivers. And then you follow again, dietary, lifestyle, temporary supplementation for 4 months is what I typically recommend, and then retest and kind of see where your antibodies are. Are the antibodies lower? Are they, are you considered in a normal range now? And then, you should typically, you'll notice symptomatic improvement too. You'll notice other improvements. So those are that's a really good way to use the testing. But those are the tests that I use. And if you need help with getting any of those tests or anything, I do work with people via telemedicine. I'd be happy to help you if you're interested in that, or if that's something that you want to do. But hopefully this information gives you what you need to better understand like this connection and understand leaky gut, and then its role in autoimmune disease, because I think this is something that's not well understood. Unfortunately, in conventional medicine, this is not something that's tested for. This is not something that's well understood. So, this is really, I'm trying to help fill some of the gaps here, because our medical system is overwhelmed and overloaded as it is. So, we have to be our own advocates and do what we can to help ourselves and help others. So hopefully this helps you. But if you have any questions or you need anything, please don't hesitate to reach out to us and let us know. If you found this episode helpful, please share and leave a review. It really helps the podcast. And as always, don't forget to subscribe so you don't miss an episode. You can also follow us on YouTube and Facebook at the Office of Dr. Brad Shook. You can join our Facebook group, the Greater Hickory Thyroid Support Group, with over 11,000 members, and you can find me on Instagram at Dr. Brad Shook. And remember, together, we can make a difference. Hey, I appreciate you hanging out with me today for this discussion of leaky gut and autoimmunity. If you got value from the show, please like it, share it with other people, and if you have a minute, go review us on wherever you're listening to the podcast, because it really helps me to help other people and to continue doing this. And if you have any questions, don't hesitate to reach out to me or my team. I'll have some information in the show notes for you. And just keep this in mind. I mean, leaky gut may be one of the most, if not the most important target that we can identify, that we can measure and work towards improving from a clinical perspective to help with autoimmunity and to help with systemic inflammation. So hopefully this has given you some value. And if you have any questions, again, reach out to us and let us know. But until next time, I hope you have a wonderful day. Thanks. Thanks so much for listening. We hope you enjoyed hanging out behind the scenes with Dr. Shook. You can also talk with and learn from Dr. Shook through Facebook Live on our Facebook page at the Office of Dr. Brad Shook. Don't forget, you can also get access to our videos, guidebooks, and thyroid programs at www.drbradshook.com. Oh yeah, and don't forget one more thing. We can change the world one person, one family, and one community at a time. Until next time, remember, today is your day, and no one will tell you who you are and what you can be.